welcome to another edition of Health Matters.
And Health Focus.
I'm Anna Marie Sinatra from Sinatra Solutions.
And I'm Ava San Marco of the Western New York Holistic Nurses Association.
And together we bring you
Focus on Health Matters.
Here we are together once again.
Yeah.
I'm so excited. We have an amazing program for you today, so they want to...
Pens and papers, get those pens.
Yes.
Knowledge.
Knowledge is power. Only when you act on that.
Right.
So make sure that you're writing down, there goes my pen, make sure that you're writing down all that information because this is going to be an amazing program. You know, many times I've shared with you some personal things, and Ava's going to share with us some personal things too. But before we get started, you know, we always have to thank our sponsors. We're very grateful to them because they help keep this program on the air. And if I can ever get Matthew Sauer from Mattress and More in this studio to tape his little spot so that he can tell you how important it is, what you're sleeping on for 8 hours a day, all those chemicals in that mattress, what we're breathing in, it's really important. You can view those past programs on YouTube so that you can still learn about it. You didn't miss too much. And let's hear from two more of our sponsors.
Hi, I'm Joe DeMarco, founder and volunteer pilot for Wings Flights of Hope. At Wings, we know that health matters, and we are there to transport people when they need to travel for their medical care. We often see people that need to travel to other cities and get the best care that's available, and that's the purpose of Wings, is to never have transportation to ever stand in the way of someone receiving the best medical care available. Keep watching Health Matters and learn about all the things that are available to help people for a better life.
Hi, I'm Jill O'Hara from Roads to Wellness, your holistic healthcare consultant and proud sponsor of Health Matters, where we bring you important information concerning your health. I know that most of us experience some distress or disease at one point or another, but I'm also aware that inside of us is a natural healer. I hope that you'll continue to view this program on your road to wellness.
Ava, I am so excited. We had such a great time at the Western New York Health Expo not too long ago, where we got a chance to come together. Your association had a table.
Mm-hmm. Our Western New York Holistic Nurses Association. And it was great. People were inquiring about it, and a lot of people don't really know all about holistic health and what it entails.
Absolutely, and that's why this program is so important. And you know, we had some of the people on from Western New York Health Magazine, and they were talking. They said, make sure we talk about the Western New York Ovarian Cancer Project, how important it is.
Yes,
how important it is, because a lot of us efforts are being made to help to educate you on this very serious matter. And I got a chance to meet someone you had been talking to on Facebook.
Yes. We
know Facebook is a great tool.
Great tool.
People find us on Facebook, they contact us on Facebook, and don't forget, like I said, YouTube and LinkedIn and all those great places they can stay connected with us.
It's just knowledge, that's all.
That's
and it's power.
It is, it is. So we have Kathleen Maxim from the West, who is co-founder and president of the Western New York Ovarian Cancer Project.
Thank you for having me.
Oh, we're so happy that you're here. Thank you. Thank you. I heard so much about you before I even got a chance to meet you. Yeah.
All good, I hope.
Absolutely, absolutely. So tell us a little bit about your story, how you got started, when the project got started, and why.
Well, myself and another ovarian cancer survivor founded this a couple of years ago, but the story really started with my diagnosis of ovarian cancer, and I was diagnosed with advanced stage ovarian cancer in 2009. And I met another lady who had had stage 1 ovarian cancer, and this year is her 11th year of survival.
Wow.
And we were both
Amazing.
very interested in doing, you know, advocacy work around this issue, and had an opportunity again to go to that Western New York Health Expo, and noted, because of the amount of health information that's given out there and who we were talking to, that this is something that needed to be done right here in Western New York. And so we took up the big heavy sack and are carrying it on.
Yeah, as you know, as we talked and as I talked with Ava and learned more about this, there's so much information. This is absolutely incredible. But what's even more incredible is that I think you talk about this as being the silent killer.
Yes, you know, and that's something that historically ovarian cancer has been known as a silent killer, something that didn't have any symptoms. And one of the things that we're trying to do with the Western New York Ovarian Cancer Project is to make sure that women know that there are symptoms for ovarian cancer. This is new information. This is new health information. Between 2004 and 2007, there were studies that were done that said ovarian cancer has symptoms. And it's one of the things that we haven't done a great job at doing a great public education program for. Ovarian cancer is very rare, but still we need to know. Your doctor does not test for ovarian cancer when you go to your gynecologist every year. You need to know what those symptoms are.
And be diligent of following them up. Because it could mimic other things like the flu.
Absolutely, and this is what we talk to women about. We say, you know, the symptoms can be very vague, and when women hear them, their eyes get big, you know, and they get very afraid because the first one is bloating, or, you know, your abdomen is getting larger, and women go, oh, I have that all the time, I hope I don't have ovarian cancer. No, this is something, if you have bloating that's persistent, that's new and persistent for you, and that it's not going away. This isn't something, you know, this isn't something where you've gone to a restaurant the night before and you had something that has a lot of salt, or you drank too much and you feel bloated the next day. That's going to go away. This is bloating. Persistent is the key word.
Yeah.
And the other symptoms, and we'll talk about those, are also very common symptoms: constipation, urinary frequency, back pain, pain during intercourse. All things that can mimic other things. So we want you to, I think that Ava just said, we want to empower women, and we want them to be able to go to the doctor and that they have one of these symptoms that has lasted, and we do have those symptom and risk cards.
Yeah, I'm holding this because this is what I got at the expo. This is really nice, along with your cards, so that I knew how to get a hold of you. And that's why you're on the program today.
Thank you
you very much.
And these are free of charge. You know, if someone wants these, and I know our information will be up on the show, if someone wants us to send them 1 card, 2 cards, we want to get these out in the community. Everything that we do with the Western New Ovarian Cancer Project is free in the community. So if someone would like these at their doctor's office, in their office at work, at the corporation that you work for, this is important new health information. And one of the things that we say, and of course, Ava, you know this, is that we really need to be able to go to our doctors and say, look, I know you think it's my gallbladder. And I personally know 2 women who had gallbladder surgery 6 months before they were really diagnosed with ovarian cancer, which was the problem.
That's amazing.
Yes, true. But true, and very scary. That's why I'm so serious about this work. You know, we want you to say to your doctor, look, doctor, I know you might think this is irritable bowel. I know you might think I'm starting to go through menopause. I know you think I'm your patient who thinks that every time she hears of a new illness that she has it. But we want you to say to your doctor, let's rule this out. Prove to me that it is an ovarian cancer.
And how do we do that? Because that is what's so prevalent, is that there are no exact tests. That's why it's called the silent killer. I remember always hearing, you know, when you find out you have it, it's too late. You know, so.
And I thought that too.
Okay,
so for
good.
any woman who might be listening, who has ovarian cancer or has advanced stage ovarian cancer, take a good look at me here on TV.
There you go.
I was diagnosed 4.5 years ago, and I've recurred several times, and I'm still here, and I'm healthy and well.
Awesome.
And I have lots and lots of stories for hope for women. But to get back to this, so what we want women to do, we want you to go to your doctor. If you have one of these symptoms, and it doesn't have to be multiples or a combination, just one of these symptoms, anything from that pelvic or abdominal pain, the bloating, difficulty eating or feeling full quickly, okay, any of the things that we talked about, the urinary frequency, changes in bowel habits, whether it's constipation or diarrhea, indigestion, pain during sex. If this is something that persists for 2 or more weeks, here's where we need you to go. Go to your gynecologist and say to your gynecologist, can we please you know, just put this on the differential. Let's see what this is, because this is unusual for me.
Right.
Okay? And then your doctor will give you, and if you take this card, the doctor will know to give you what's called a CA-125 blood test, and also a transvaginal ultrasound. But I want to caution women, because Ava and I have talked about this.
Yes,
This
we
is
have,
not
yes, I
this,
know.
this is not a test that every woman needs to have at the gynecologist all the time. Ovarian cancer is very rare. This does not diagnose ovarian cancer. There is no screening test
Yeah,
for
there's no
ovarian.
definitive test for that. So that's why you have to be, you know, diligent. But I think too, having a gynecologist oncologist, that helps too.
Well, that is, and that's excellent information, and that's the next step. You're at your gynecologist. We don't want to send people right to the gyn-onc, we call them, okay? We don't want to send them right to the gyn-onc, because ovarian cancer is rare. And just to give you an idea, with breast cancer, we're seeing 1 in 8 women diagnosed. With ovarian cancer, we're seeing 1 in 70. Okay? So there's a big difference between the number of women who have breast cancer and the number of women who have ovarian cancer. But this disease is very deadly. This is the deadliest of the gynecological cancers.
And would you say it is because it doesn't get caught until much later on?
Which brings us, yes.
Normal
Yes,
and
yeah.
unusual circumstances?
Most women get caught in their disease is diagnosed in advanced stage. Okay, and it is very deadly. I want to drive this home with a statistic. Okay, 22,000 women will be diagnosed with ovarian cancer this year. Most of them will be diagnosed in advanced stages. Nearly 15,000 of those 22,000 women will die.
Wow.
The importance, and just to bring this back to what Ava said about the gynecologic oncologist, once you have these 2 tests and your gynecologist comes back to you and says, okay, we're seeing something on this transvaginal ultrasound, and we have this information from the CA-125 blood test, and that looks elevated. The next step would to have more tests. We want you to have those tests and then be seen by a specialist, and that specialist is a gynecologic oncologist.
Exactly.
And we also, this is very important, we saw studies done last year on the importance not only of survival of women who have their surgeries done by a gynecologic oncologist is higher than if your gynecologist says, oh, I'll do the surgery and we'll see if something's there. And then if something's there, we'll close you
Exactly.
up and send you
Oh
to
my
the,
goodness.
which is, you
Not the
know
best way.
this,
Not the best
you're a
way,
nurse,
because-
and
Because you know why? They're not specialists in that. And they could miss it.
they could miss it. I think the other thing that I want to impress upon you about the specialist, the gynecologic oncologist, is that these doctors are trained to do extensive abdominal surgeries. And this is going to be a little graphic for your audience, but the difference between a regular gynecologist would never go in and do something as aggressive as maybe doing a bowel resection. But if a gynecologic oncologist does your initial surgery and there is bowel that's impinged upon
You've
by
got him
tumor,
right there.
they're going to do that aggressive
Right,
surgery.
Well, you know what's so beautiful about what you're doing is that you're an advocate. If someone is concerned, they can reach out to you on your website, on Facebook, they can email you, because you walk hand in hand with them, as well as this little card, which is very helpful because knowledge is power, as we said, and only when you act on it. So you get these cards and then you have a tool. And if you have a concern, then you call or you reach out and you get somebody who can help to hold your hand and walk you through this.
Right.
And
I had an experience this past February. I was diagnosed with stage 1 ovarian cancer. It started actually in November. I noticed some symptoms. My bloating was getting worse. I was starting to have nausea and vomiting. So I went for tests, and they referred me to Roswell, the gynecological oncologist. Now, I have to tell you that I was scared every time I saw Roswell pop up on that screen, and they said, we can't guarantee that you have cancer, but we suggest that you do this. And then it came out with the diagnosis.
And Ava, if I could just interject too, is that you had something else that they were looking at in your stomach area.
Yes.
So you didn't even know. So in a sense, we look at and we say how grateful we are because you're stage 1. Had you not had the concerns about some stomach issues, you would have never caught this. So it's a blessing in disguise.
Right. I was very fortunate.
To be able to catch it so soon.
But others, fortunately, aren't, you know. And then I started having the pain on the right side. So
yeah, and
think that's how it happened.
And I think that the importance of your story, Ava, is probably the most important thing that can be conveyed to a woman on this show today. That if you are in pain, don't pass it off. Right. I had terrible pain the summer before I was diagnosed. And I thought, oh, it was just a terrible cramp in my side. But it was more than a cramp. And I thought, oh, it'll just work itself out. And then it went away. I had the bloating consistently. I had the constipation, but I was very busy. And we are, as women, very busy. We have careers, we're taking care of family, and we put other people first. And if there's anything I can impress upon you is the difference between a diagnosis, and it's right here in front of us for our audience to see, is that the difference between a stage 1 diagnosis like this, where that you went to the doctor in November, and then there were subsequent tests that were done, and then when did you have your surgery?
February.
In February of this year, got to that very quickly, got to that diagnosis of stage 1 ovarian cancer, where survival statistics are enormously high. We're seeing, 95%, and that's a wonderful thing. Not that anybody wants to be diagnosed with cancer, because the other day Ava and I were talking, I said, but I know you're only focusing, it's that 5% that's scary.
Right, exactly.
Right.
But certainly women who are diagnosed in advanced stage, like I was in 2009 when I got my prognosis, and I asked for my prognosis, my doctor looked at me and said, you have a 20% chance of living for 5 years.
Wow.
Wow, Kathleen. Wow.
It's a devastating, very scary thing. And right now in history, and this is why we do what we do the symptom and risk information. What we're doing is we're saying to women, don't wait. This isn't a silent killer because it does have symptoms. And even women who are diagnosed with stage 1 ovarian cancer have those symptoms. And thank God Ava was proactive enough to say, you know what, Doc?
To do that,
Something's wrong.
Yeah.
And you have to push them. You can't, this is where we want to empower you. This is what this program is all about, that we have to be proactive and we can't be afraid to talk to our doctors. We have respect for them, and they are our doctors and nurses and PAs and LPNs and all that, but at the same time, knowledge is power, and asking questions and pushing ahead, because of course our doctors want us to stay with them. But I had a little scare a long time ago, because I was looking at some of the risk factors for your history. And as soon as I thought there was a small, I said, oh, I'm going to Roswell. And they said, well, you don't have to go to Roswell. This is like something so little. I said, you know something, I love you, Doc. You know I love you. I've been with you for a long time, but we got a little scare here, and I'm going to Roswell.
And it's being proactive.
Yeah, and I wound up to be fine, thank God. But I was like, no, I'm not messing with this. People come from all over the world. Whoop, I'm right there.
And I can tell you, as a woman who didn't know that ovarian cancer had symptoms until after I was diagnosed, and I was also at very high risk, and we'll talk about those risk factors. It's very high risk for ovarian cancer. I can tell you, I would give anything to be able to go back in time to when I first noticed that bloating, to say, this isn't going away. This isn't a matter of, I passed it off. I was like, oh, I need to do more sit-ups. But that wasn't what it was. So we want to get the woman who always is going to the doctor and checking in with those things. We want to encourage her, keep doing what you're doing, sister, because that's the way you're going to take care of your health.
Exactly,
I know
our
that
sisters.
Yes.
Our Keel sisters.
Yes. So, we want to encourage all women to, if there's something wrong, go to your doctor. The other thing that we want you to know, though, is that you may be at high risk for ovarian cancer.
That's what I really want to talk about, is the risk factors, if we can hit on a few of those.
So for myself, and I'll just start with myself because I think it's, they're interesting. I was genetically predisposed to ovarian cancer. And I have that BRCA1 gene. I didn't know that I had BRCA1 until after I was diagnosed and did some genetic testing. But I had a sister who had breast cancer. And because she had breast cancer before the age of 50, that put me at high risk.
Okay.
Okay, so breast cancer is very prevalent. And
would that be for a mother or a grandmother?
A mother,
all
that,
that
yeah.
too?
Absolutely, a mother, a grandmother, an aunt.
Okay.
And the other thing I want to stress is that on either side of the family,
Okay, that was my next question. Does it matter paternal or maternal?
and a lot of people think, oh, it's only on my mother's side. Well, it's my dad's side that has the BRCA gene in it, because my dad has BRCA. And because you have BRCA doesn't necessarily mean you're going to have cancer. My dad's 85, he still goes to work, God love him, and he's never had cancer. However, my sister and I both have had cancer. My sister had breast cancer, I have ovarian. So there's a connection between breast cancer and ovarian cancer that a lot of women aren't aware of.
Interesting.
And here's how we can really drive this home. Everyone knows who Angelina Jolie is.
Right.
Yes.
Angelina Jolie, her mom passed away from ovarian
Right.
cancer. And also her aunt just passed away from ovarian cancer. So as a young woman, she's making very difficult decisions
Right.
about prophylactic surgeries. And we all
Exactly,
know
yeah.
that she had the radical mastectomy.
Right.
And then we all know that she also will, if she has not, I thought I saw in the news the other day that she either did or was planning on having the surgery, the prophylactic, what we call a hysterectomy and oophorectomy. The
Right.
oophorectomy is the removal of the ovary,
Right.
which will lower her chance of getting ovarian cancer to less than 2%.
Wow.
But these are big decisions.
They're big decisions, but they're
Yes.
smart because they're being proactive. You know, why take a chance with your life if you know? I think the
Exactly.